Hello, Assalamu alaikum, Shat Shri Akal, Namaskar, everybody. Today we are joined by a guest. He is not from the world of entertainment or politics or sports that we keep talking to. Today we have with us Mr. Pankaj Lochan. He is a group the HR head from Jindal Steel and Power Limited, JSPL. We'll be talking about the challenges faced by the industries in general, but JSPL in particular in the time of pandemic and the continuity, business continuity that he as a group HR head has to maintain on different sites. So, Mr. Lochan, welcome to Janata Ka Reporter.
Thank you, Javed ji. Yeah.
So you have recently joined, but last month, you embarked on, you took an initiative which was widely hailed that, JSPL became the first major company in India to, decide to approach vaccine manufacturers directly in a bid to kind of vaccinate your staff. Tell us more about that.
So, Javed ji, I think while many other companies, also approached the vaccine manufacturers, we thought we're not looking at others, we're just looking at ourselves. And, people is our priority. And in this pandemic, keeping people at the core is very important. So, so just now all our paramedic staff has got vaccinated already. And that was the first phase that I referred to in the last conversation. In the second phase, actually, we are looking at a lot of a prioritized list of employees. Prioritized meaning those who are more vulnerable. And we're just looking at them first, that's our priority to vaccinate all of them in the second phase. And then we're looking, subsequently getting everybody vaccinated in the list.
So how do you decide the most vulnerable, the group?
So of course, so we have a set of factors. We look at, the kind of comorbidities or, the age is another factor. So we've kind of made a priority list of first 20% to go, apart from the paramedics. So people with more number of human interfaces are on the priority, and people who have these some kind of complications or comorbidities.
Right, and getting access to the vaccinations, was that difficult or it's been easy?
So the Serum Institute of India, they've been supportive, and then we've got access, and then of course we are looking for more numbers, and that's how it'll the shipments will scale up, and then we'll cover all our employees.
Right. Although you joined later, quite recently, but the last year, there was we had to deal with a prolonged period of lockdown. And JSPL in particular did remarkably well in terms of the growth, despite going through the period of uncertainty. How big a challenge is that for you, to maintain that momentum? We are still not out of the pandemic fully yet.
Yes. So it's a challenge because first of all, the standards are set very high. Both in terms of the kind of business continuity we had, and more importantly, the kind of way we dealt with our people, our employees, keeping them at the center of everything. So I think both ways we are trying to maintain the same and do a little better than what we did last time. So with this new wave approaching, I think we're all gearing up. In a couple of days, we'll have our strategies clear.
Yeah, that new wave is very crucial because while India has largely been unscathed, by the relapse of the COVID pandemic. I mean, although the countries like UK and other European countries are still bearing the brunt of the prolonged period of the COVID-19 pandemic. There are, we hear sort of news from Maharashtra that they are planning to sort of impose another wave of lockdown. How is JSPL kind of preparing? You're saying that you will work on the strategy in a couple of days. If you like to share something now.
Yeah. So broadly, we outlined the whole thing on three things. We continue our whole strategy on vaccination, which is in order of priority, as many shipments as we get. The second is the whole thing of considering COVID as a reality and grappling with the whole thing, like things like working from home and having video conversations even when you're at work, between two teams or things like that. So we're kind of making SOPs and making them abundantly clear to people. So that, because we all feel that precautions are, prevention is always better than cure.
True.
So, every bit of communication. So I think the center of this entire thing is two things, the care for people at the center, and the communication. We communicate and communicate. And then, the backed up by, of course, a very robust, an infrastructure team.
And also one of the key things is that, the level of anxiety that exists amongst, I'm sure like that would be the same amongst your staff members as well. Do you have any structured plan in place, whereby, the continuous conversation is being had with your staff members to kind of reduce that level of anxiety?
Yeah, so this is again at three levels. First is, the people who are at, who have multiple interfaces and they know the kind of concerns around, moving around and doing their job properly. So, the first thing that we tell them is that we are there. And with the kind of prevention methods that we have deployed at sites, so be it sanitization, be it, the other methods of preventing, infections and, continuous use of masks, communicating. JSPL is one of the very few companies that I know of who have their own good quality masks given to all employees. Every employee you would see wearing a Panther mask.
Right.
So the very high quality mask.
And where are you procuring those masks from? Are they like?
So we are getting them made. We are getting them made, and we are distributing them free of cost. So very good quality masks.
Right. And coming back to the vaccinations part, of course, you've had.
Yes. So sorry, I think I missed out. I missed out another important point. The second is that, there are from as a HR head, I also look at the kind of psychological impact on people and their families. So at some level, we are also doing a lot of counseling sessions.
Yeah, that's what I was.
It's been very effective.
Yeah.
A lot of people, working from home and doing a lot of good work from home, and we are encouraging that, and also, making it very clear that, working from home and working effectively, it could be the new normal, and we are okay with it.
And also, not to forget that,
except for operations,
go on, please go on.
Except for operations where, a physical presence is required.
It's absolutely needed, but also not to forget the impact on the family members of your staff. For example, the children who are not able to go to school now, and they have to rely on kind of, the mobile devices or laptops, in order to continue with the classes.
And Javed, there's another thing that I would like to tell you is that the most important driver here is our honorable chairman, because the way he, the kind of questions he asks, the kind of support he provides for anything related to, the welfare of people. I think even in the whole COVID scenario, he's the main driver behind everything.
No, I've seen he's been very proactive, sort of reaching out to the staff members, even during pandemic, like going visiting different sites and all.
Very accessible. Yeah. Very, very accessible.
Yeah. But coming back
and more, very, very concerned. He keeps people at the core of everything. That's how we get our energy from.
I should know it because I know, he's been a great well-wisher and good friend. And also, I totally agree with you. Somebody like who can really connect with people, who understands the pain of the masses. And I don't think he treats his staff like a staff, he treats staff like his family members. I can tell you that, very safely.
So as an HR head, I know I cannot go wrong anywhere on people, anywhere on welfare, anywhere on amenities. Anywhere on infrastructure.
Your thing has to be in sync with his own feelings, so that way. Yeah. But coming back to the vaccination, the people who have already got vaccinated, how risk-free are they? How have they responded?
So it's also about the kind of communication that you make about vaccinations. Again, it's a part of our whole prevention strategy, and the way we communicate it is that, while we, are vaccinating all of you and we're going to take care of that part, the prevention, the whole set of sanitization and the whole thing has to go hand in hand. And, it's kind of one thing, with all elements put together. So that's how we are positioning it in the organization. We are not saying that if you are vaccinated, you are 100% safe. But yes, we must get vaccinated.
So they'll still have to maintain the social distancing. They'll still have to adopt that sanitization process and all.
Yeah. Our chairman calls it physical distancing.
Okay. And who enforces that at the ground level? Who enforces that?
So what has happened, Javed is that over the period of last 6 months, all these have got translated into the operations SOPs.
Right.
So if there are two operators standing, there would be circles marked in the plant or in their stations, how far they have to stand. There are times when you communicate standing next to each other. But suppose you're carrying a walkie-talkie, you're actually communicating on the walkie-talkie rather than standing next to each other and talking. Even when you're talking, you're maintaining a distance essentially of 6 feet. So when you put those markings and those SOPs and those, also create those bylines which are not written in the SOPs, something like that. And of course, the most also at a very operational level, one thing which is driving this whole thing is the toolbox talk that we do in the morning.
Okay, what is that?
Every day begins with a safety talk at all the plant locations. And in that safety talk, which used to happen earlier also, that's known as a toolbox talk. And because TPM is there in all our plants. And in that, very specific things are mentioned with respect to the hazards present on that particular site. Okay. So it's not kind of a general communication, but a very specific one also.
So that okay, I mean, these are the things that you have already done and it's working well, but I'm sure you must have encountered challenges also. It's not easy, especially in the time of pandemic. What are the challenges that you're encountering?
So two challenges. One is in a very workforce intensive industry like steel and power, where people have to stand next to each other. Recreating those SOPs of, where safety becomes paramount and yet not relenting on your operational productivity is a big challenge. That's the biggest challenge actually for manufacturing industries, because these are manpower intensive areas. And how do you prevent, sometimes the prevention of people getting close to each other, brings down the productivity. So our biggest challenge was maintaining productivity while we redo these standards of physical distance. So that's one challenge. The second is, dealing with the fears of people, dealing with, the psychological apprehensions, the families back, people locked up in colonies, and because our colonies are very safe, we don't allow people to go out. But then, it causes a different kind of set of things, you're not going out home, you're not traveling, this and that. So, we're doing a lot of counseling sessions to allay those fears, to mitigate those fears and all that. So I think these are the two things that are important here.
And also there is a cost implications, right? Now that like you have to implement all these SOPs, then the cost of vaccination, the people working from
Very
home,
true.
Is that monumental? What I need to ask, is that monumental, or it can be actually, compensated with?
I would answer it differently. Looking at our basic philosophy, we are a very cost conscious company. We look at every element of cost. Every week we have a very rigorous review. But when it comes to these essential things like doing what is necessary for COVID, we don't count that money. Okay. We don't look at that.
Okay.
So it's a I would say it's a ambidextrous approach where at one hand you're very, very cost conscious about every waste that you incur, and on the second hand there are certain things like related to infrastructure or kind of expenditures for COVID where we don't care what kind of expenditure goes in. For our chairman, people is at the center of everything.
That would be very reassuring for your staff. I mean, this coming from you and Mr. Jindal would be very reassuring.
They see this. So these see these paradoxes together, and then they understand that we are very cost conscious on one hand, and yet for these essential things we don't worry.
Right. Okay, so thank you very much. But also, you've been an author, right? You've authored 3 books. I was just going through that, and quite, quite niche book for the management, right? So I can see one book you wrote was Strategy and Policy Management on TQM Publications, book 3. Then Delhi Work Management, and the another one was Organizational Quality Management. Clearly you had time to write all these sort of impressive books. Are you working on any more books, or you're too engrossed in your work right now?
So actually these came up so these books were a product of last 7-8 years of work. So they came up together. It's just that the publication has been kind of moved at a distance of six months from each other. So all the books are so it's a set of 7 books that cover the entire set of the management functions that we deal with. So the next one coming up is employee engagement.
And
So
when is
it's
that
already
coming
under
out?
print. It's already under print. I think in a month's time it should be there on the stalls.
So that will be the fourth one of the 7-part series.
Yes, yes.
And then we would expect 3 more.
Yeah, so they've already been written, but they're kind of being strategically positioned one after the other, because the set of readers is the same. Is the same set of people who practice total quality management. Major countries now, in India, of course, TQM is being given a big push. Companies are going for the Deming Prize, and there are a lot of big companies. And of course, the Southeast Asian countries, a lot of them. Japan, of course, my books are, read in Japan, and US also. So you will find hard copies in US as well, and in all these countries.
Wow, I was just going to ask you that, I earn as somebody, as a journalist who earns his livelihood by writing, yeah, even I don't have that much of time to write so many books. How do you manage that?
Okay, so I had over 3 organizations. I had a role of quality head. So that is a time when I've just penned down my own experiences with various manufacturing companies and also industries. I would say, for example, cement, power, steel, pharma. I was working with a pharma
Dr.
company
Reddy,
as well.
yeah.
So yes, Dr.
Yeah.
Reddy. So I have penned down all my experiences and made those books kind of very practical in terms of provided formatted approaches. You can just follow the format and do something. For example, if a company has to draw its long-term plan, you can just refer to the chapter on long-term plan and make a long-term plan, and then you experiment with it and you can improve it. Same holds true for your business plan, for your environment analysis. So these are very niche subjects, and the audience is small, but of course the book has been received well.
Perhaps I need to sit down with you one day to understand the time management. That is key here. That's where I struggle. So yeah, thank you very much, Mr. Lochan. Really appreciate this, and wish you all the luck. It's not a sort of easy role that you have got yourself into, but I'm sure as JSPL has been, you will fly. So you don't need my wishes there. So thank you very much for joining.
Thank you so much,
and
Javid.
speaking to us.
Thank you so much. Namaskar. Thank you.